Bienvenidos, bienvenidas. Estamos todavía esperando.
Good morning and welcome. We're waiting for the participants to join the session.
Bien, bueno, vamos a dar inicio mientras se siguen uniendo.
Well, as more participants join us, let's start the webinar. We're here today in this course, El Niño in the Americas, Protecting Health and Promoting Resilience, hosted by the World Meteorological Organization, the UN Office for the Disaster Risk Reduction, PAHO, the Inter-American Institute for Global Change Research, and the Global Consortium on Climate and Health Education. Today, we will be talking about heat extremes. I will be your moderator as the strategic advisor at the IAI. Please choose the language of your choice. You can find the languages at the bottom of the screen on the Zoom menu.
Language of your preference in the Zoom menu. Bien. Como pueden ver, esta es la segunda sesión.
As you can see, this is the second session in the course. Next session will be held on Tuesday, the 17th of October. Today, as I was saying, we are focusing on heat extremes, and some more participants are joining as we speak. I would like to remind you how the sessions work. Today, we have a 90-minute session. At the end of the session, we will have a Q&A section. Please write your questions and answers in the Q&A section in Zoom. We will be recording this session. The session is being recorded now, and we will be sharing the link to the recording within 24 hours on our different platforms such as LinkedIn. For instance, in the chat, we have included the LinkedIn link where you can access the materials. The materials will also be included on our websites, both the IAI and the GCCHE. Okay, so more people are joining us. Today, here we have some of the recommendations that were prepared by PAHO. So we suggest that you review the link shared in the chat. This link will also be shared in our LinkedIn group. Please join our LinkedIn group so that you can access all the materials. If the information hasn't been updated yet, we will be doing so within 24 hours. Please bear with us. If you speak English today, we will be having this session mostly in Spanish. So please have a look at the slides in English that Haley has just shared in the chat so that you can follow the session more easily. Okay, let us now begin with Francisco Chesini, who works at the Environment Ministry in Argentina. He has a degree in environmental health awarded by the National University of Entre Rios. He's a specialist in health engineering from the University of Buenos Aires, and he's now doing a master's degree in that university. He's currently a technical leader at the National Program for the reduction of health risk associated with climate change at the Coordination of Environmental Health in the Ministry of Health in Argentina. He's a member of the Ibero-American Society of Environmental Health, CIPSA, and the Interdisciplinary Laboratory of Climate and Health. Then I would like to introduce Tania Vargas, who is here today, and she will be presenting a case study. Francisco, you have the floor. Thank you, Irene, and thank you to the GCCHE. Thank you, PAHO. Thank you, the WMO, and also the UN Office for Disaster Risk Reduction. Thank you for inviting me to participate in this interesting course and very relevant course to relevant to our current times. And uh, especially regarding El Niño phenomenon. As Irene was saying, today we will be talking about El Niño regarding or in connection with extreme temperatures. Today, these are the topics that I would like to address regarding the connection between El Niño, extreme temperatures, and health in the Americas. Please have a look at the topics for today. First, we will be addressing the health risks approach, and this will be today's session. Then we will be talking about El Niño and temperatures in South America. Also heat waves and climate change and how these waves interact with El Niño. Vulnerability to heat waves, health effects of heat, and from that we will be talking about public health actions such as developing early warning systems, preventive measures, hospital readiness, and health monitoring. Please include your questions in the chat, and after my presentation, after Tania's presentation, we will be having a Q&A session. As I was saying, I aim to start today's session by implementing a health risk approach, considering in particular how climate on its different levels impacts health from a natural variability perspective, as in the El Niño phenomenon, and also South Oscillation El Niño, and how man-made climate change, how both in a synergy have an impact on the distribution of meteorological and climate phenomena regarding health risks. And also there are two other factors that impact the risk, and these are vulnerabilities as the individual and community capacity to face these threats, and also exposure regarding how these people are exposed to these meteorological phenomena. From the intersection of these three fields, threats, vulnerability, and exposure, we have health risks, as in the probability of something wrong happening. And we are paying attention to probabilities here. So how can we reduce this risk? The risk can never be fully eliminated, but we can reduce it by implementing two approaches. First of all, disaster risk reduction, and also climate change adaptation. This is our conceptual framework for today's session. So first of all, let us have a look at, briefly have a look at the El Niño Southern Oscillation, or ENSO, as a phenomenon that changes the atmosphere ocean group in the tropical Pacific, and how the change in these conditions in this area of the Pacific, changes in temperatures or increasing temperatures in the ocean in this area of the Pacific, El Niño, and also Niña, which is a decrease in temperatures. All of this is part of a cycle whose frequency varies between 2 to 7 years. At the top, you can see how these phases have varied since 1980 between El Niño and La Niña. We've just gone through 3 La Niña years, and now we're beginning an El Niño period. This entails changes in a global climate, but in particular in the Americas, this entails changes in the humidity and temperature patterns. On the right, at the bottom, you can see the main El Niño events that we have had since the 80s until today, and how El Niño, this new El Niño that which you can see in gray in 2023 is taking place. This would be a moderate El Niño compared to other events that have been more serious. But of course, it remains important. El Niño has been thoroughly studied regarding the changes in precipitation distribution in our region, and to a lesser extent regarding temperature anomalies. Here on the screen, we can see the temperature anomalies expressed in an increase in temperature or temperature decrease compared to the historic mean figure for 4 3-month periods in our region. So on the first map, we have December, January, March, then until May, number 3, June, July, August, and number 4, September, October, November. This would be the 4 seasons that we have in the Southern Hemisphere from summer to spring. We can see that the surface, the air surface temperature is connected with increased temperature with El Niño phenomenon. In particular, regarding temperatures above 20 degrees, well, actually in the intertropical area in our region. Here we got, and this includes the north of Chile up to Colombia, Venezuela, and also some Central American countries. These countries will be expected to have increased temperatures above the normal figures, both in summer and autumn. Okay, I'm saying summer and autumn because I'm thinking about from an Argentina perspective. This would be December, January, February, March, April, May, actually. And in particular, in the south of South America, so that is Argentina, Uruguay, south of Brazil, and Paraguay. We're expecting anomalies with temperatures below the usual level. So regarding heat anomalies, we're not expecting an increase in the summer. So El Niño would not be causing increased temperatures for the south of South America. This might happen in the north of Chile and northeast of Argentina, however. And these may also persist in autumn. In autumn, we already see some anomalies for the south, in the south of South America, in particular, central and north Argentina, Uruguay, south of Brazil, and north of Paraguay. Therefore, the countries that are at the highest risk of increased temperatures for the next few months are the countries that are above 20 degrees of latitude in the south. Something we must remember, the ENSO phenomenon includes at most 2/3 of the interannual temperature variance. This means that this does not explain every change, and some changes can be due to other variability phenomena or by general climate change trends. And this is what we can see here. Since 1940 until last September, here we have the series of covering every September month since 1940. And have a look at 2000. Until the year 2000, the anomalies were below the historical anomalies. And as of 2000, the frequency has increased. In particular, last September, there was almost 1 full degree above the historical data globally for September. And this entailed increased temperatures throughout the north of South America, also in the south of North America, and in parts of Central America. This is something that we can see we saw through a major heat wave in Brazil that took place very recently. What's happening here in the south of South America regarding extreme temperatures? These maps are organized from the top to the bottom according to each quarter. Between December and November. We can see that for winter and spring for the southern cone, so that's June, July, August, September, October, November, we can see an increase in the frequency of hot evenings. So these are minimum temperatures above the 90% percentile, which entails an increase for center and north of Argentina, Uruguay, Paraguay, south of Bolivia, and north of Chile. This is a case in particular in June, July, August, and September, October, November, while maximum temperatures above 90% percentile that correspond to hot days are expected to increase in the northwest of Argentina, north of Chile, and in some cases also in the south of Brazil and in Uruguay. Therefore, El Niño is associated with hot evenings in winter and spring in the center and north of Argentina through teleconnections. This has been studied since 1979 and 1979 until 2005, and we can see this paper written by Cochazo et al. What does WHO say about the key health risks regarding El Niño for this new season? Well, heat stress and air pollution. We are expecting a high probability, and this might have a moderate public health impact and a high risk level. This is based on the fact that heat stress is a leading cause of climate-related death, which can exacerbate underlying NCDs. Also, air pollution is a result of multiple mechanisms, including smoke from forest fires, which can increase this risk, and also increased temperatures might explain the presence of some secondary contaminants such as ozone. Well, this has to do with El Niño and extreme temperatures. But I was saying El Niño cannot fully explain the behavior of extreme temperatures in the next season. Rather, heat waves are also associated with climate change. How? First of all, we need to say what we understand by heat waves. Heat waves are an unusually hot, dry, or humid period that lasts 2-3 days or more and usually has a clear beginning and an abrupt end. It can have a negative impact on both humans and ecosystems. The IPCC tells us that since 1950, globally, heat waves have become more frequent and intense. Also, in every region on the planet, extreme heat events have caused human mortality and morbidity. Therefore, this might mean that El Niño and climate change might create a synergy, and this next upcoming season might see an increased risk for health regarding heat waves. So if we go back to the first chart, that has to do with the risks. But we also said that health risks are also determined by the intensity of the threat, but also by vulnerability factors. These are individual and community factors. Individual factors include age, medicine consumption, physical conditions, health, and other factors such as type of housing. There are also some community factors that will impact vulnerability, such as income, how the city has been designed, also if the health system is ready to face these events or not. Also working in exposed environments, air contamination, pollution, etc. Based on this, we have created vulnerable groups, groups that are vulnerable to heat waves. There are the two ends of life, population age 65 and over, also babies and children under 5, people with chronic diseases such as diabetes, cardiovascular disease, mental diseases such as Alzheimer and Parkinson's, also high blood pressure and morbid obesity. Also people that are under treatment with different medications and other drugs, and also older people that live alone or the people that live in the streets in negative social and economic conditions, people with disabilities, people who are exposed because of their work in outdoor areas, and also people that perform activities that create a lot of metabolic energy, such as high performance sports people. Some individual factors that increase vulnerability in the Americas. This corresponds to the indicators available on PAHO's website. In the Americas, 40% of the population is age 65 and over. And this means 130 million inhabitants for our region. The population of children below the age of 5 amounts to 6.6%, and this amounts to 69 million children in the region of the Americas.
And if we think of adults, we have some risk factors connected to non-communicable diseases such as high glucose, with a percentage of 8.4 in the region, but with a range of between 5.5% and 14.5% in the region. The prevalence of overweight and obesity is 62.6%. So 6 out of 10 people in the Americas are either overweight or obese. And high blood pressure is 17.8%, with a range of between 12.9% to 27.1%. And each of these risk factors may be present synergically in one person. One person might have high blood glucose, high blood pressure, and be obese. And they also might be 65 years old or more, so those add up. Another very particular phenomenon in our region that comes on top of the other complex factors for addressing heat risk in the Americas is urbanization. The region, Latin America, is the the developing region in the world that has the most urbanization, with cities ranging from 20,000 inhabitants to the largest cities, urban centers that have dozens of millions of people living there. So they're growing continuously since 1950, and the growth has been exponential, while rural populations have remained constant. And I wanted to highlight this because the heat wave can take place and then come on top of some other things that happen in cities that are heat islands. This, it means that because of the way they are formed, Cities have some, because of the materials they're used for buildings like concrete, the thermal isolation. This causes heat to be accumulated during the day, and that heat is then released at night. So there's a temperature difference that is very high between rural areas and cities. If we travel a bit away from the cities, we see that the temperatures decrease dramatically. We see this for the three most populated cities in Argentina: Buenos Aires, Rosario, and Córdoba. And so we see during the summer the temperature difference between the city and the surrounding rural areas is 1.2 degrees, but at night that difference is up to 2 degrees. So between downtown Buenos Aires and the rural areas outside. This observation is similar for Rosario. It's double the temperature difference between days and night. It happens the same in Córdoba, with a smaller difference than the city of Buenos Aires, because they are smaller than Buenos Aires, but it's still remarkable. And how does that urban heat, we're dealing mostly with the urban areas, but it does also affect the human health in rural areas. Our human body, we are homothermal animals. We manage an internal stable temperature, so we're always exchanging heat with our environment through processes such as releasing heat by radiation, conduction, convection, and evaporation, mostly of sweat. So there are other factors that also affect these processes, such as behavior, such as cognitive or physical deterioration, psychiatric illnesses. For example, babies cannot regulate as well. They increase in heat gains because of metabolic heat, but because we're exercising or we're taking certain drugs. Some factors that affect cardiac expense, some factors that reduce the volume of plasma, such as diarrhea, kidney disease, again, some drugs, and some factors that affect sweat, such as dehydration, aging, diabetes, and some drugs as well, again, have an effect here. So what has happened in our region regarding heat waves in the in recent times? The most recent information we have is for South America, is from the Lancet Countdown Report for South America. And we see that heat-related deaths have increased by 160% during the 2017-2021 period. Also, in 2020 was one of the 3 years with the most heat-related deaths for all countries, and 7 of the 12 countries reached some historical numbers. Brazil, Argentina, Colombia, and Venezuela have been the most affected. And if you look at the charts on the right, the trend is growing for all countries. In Venezuela, there's a drop at the end. In Uruguay, the trend seems to be more smooth, but in general, overall, the trend is going upward. And this is something we see in the region because of the frequency and intensity or severity of heat waves. In Argentina, we looked at a specific heat wave during the summer of 2013-2014 that affected mostly the center and the north of the country. And in December, it reached 17 provinces, and it lasted on average 6.9 days, but this was highly variable. And in 7 of those 17 provinces had an increase in mortality. There were 1,046 excess deaths. There was a shorter heat wave during January that affected 16 provinces and increased mortality in 6 of those. There were 635 excess deaths. And finally, there was one in February that was quite long and affected the provinces in the northeast of Argentina and the south of Brazil and also the south of Paraguay. And in 3 of those jurisdictions, we had an increase in mortality that was quite significant, and there were 196 excess deaths. In that study, we were also able to see that the death risk increased with age, especially in people aged 70 to 79 and 80 and older. And we also saw that some causes of death showed an increased risk, like respiratory diseases, cardiovascular, strokes, etc. Globally, there is a lot of evidence about the connection, the relationship between heat and non-communicable diseases. And I think this is a kind of a novelty to think of this in connection with El Niño, because we had been studying the El Niño so far in connection with communicable diseases, with some outbreaks caused by some vectors, zoonotic diseases. But as we have seen in our region, there's an epidemiological transition that has already taken place, and non-communicable diseases have more weight than communicable diseases. So we can't forget about this, because there is a risk to health associated with extreme temperatures in terms of non-communicable diseases. These are some pieces of information from the literature that the risk for stroke increases by 1.5% for each degree of temperature that increases. As for cardiovascular diseases, heat waves have been associated to an 11.7 increase in the risk of cardiovascular death. For respiratory diseases, heat waves are associated to an estimated risk of 1.18%. And as for diabetes, the risk of mortality during heat waves was 1.18 for mortality and 1.10 for morbidity. And this is in terms of mortality, and looking at the main non-communicable diseases, the 4 that are the most relevant in our region, which are also represent 80% of the deaths by non-communicable diseases. Also, since the 2000s, there's an emerging disease in the Caribbean that was described first in the 2000s, and it's chronic kidney disease from non-traditional causes. It has affected workers in the last, and 20,000 workers have died in 10 years. And why is it non-traditional cause? Because we have patients that come in with terminal kidney disease, but they had none of the risk factors, diabetes, hypertension, or obesity. Most of the cases are in young men who work in agriculture, but not just that that subset of workers. There are also some people who drive in public transportation, some garbage collectors, some street vendors. So in the beginning, because they were mostly farm workers, they thought it was connected to pesticides, heavy metals, or extreme heat. And the conclusion that was reached the most recently is that heat is mostly the cause. So what are the public health actions that we can do? First, we need to plan our actions. We need to think of what to do before these heat waves. These are the minimum components. We can think of more complex ones. But the first thing is counter-season planning and during winter. So that's, I say winter because I have the bias that where I live, we have very clear seasons, but we need to think of this before they come. We also need to establish early alert systems jointly with national meteorological services. So the ministries of health need to reach out to meteorological services to develop these systems based on epidemiological information and evidence. We need to have communication flowcharts, who, what, and when is going to be communicated to establish care for the general population and vulnerable groups. We need to train the health systems and social services to care for the population. We need to bring in other actors because, as we have seen, the workplace is somewhere that the risk can be increased. We also need education. We need to include sports. We need to monitor health in real time as closely as possible. Perhaps the closest thing we could have is the epidemiological week. But if we look at it after the season, that is also good. And we need methodologies to assess the phenomena once the season of heat waves is over. As for early alert systems, I'm going to discuss the one we have in Argentina for extreme temperatures, especially for heat, but we also use it for cold. It has 3 levels of alert. The red one represents high to extreme effect on the health. Orange means moderate to high impact on the health. For example, dangerous for babies or people over 65 years of age or with chronic diseases. The orange level can be very dangerous for at-risk populations. The red one is for represents extreme impacts, and it can affect everyone, including healthy people. This system was developed jointly by the Ministry of Health of Argentina and the Meteorological Service, and it was based on different epidemiological studies generated in the field of atmospheric sciences and public health. What are the criteria for issuing alerts? For yellow alerts, which is the lower level, they are issued based on the forecast. If the forecast for the next 3 days shows that there's a likelihood of a heat wave, then we issue the first alert. And it can be maintained if, for example, in Argentina, a heat wave is, we have established a threshold for each meteorological station, a temperature threshold. And then if during the next 2 days, or if 2 continuous days have already been observed with those higher temperatures, or 3 days of heat wave, but with no forecast of that continuing. However, if we have 3 days of heat wave observed and there's a forecast within 24 hours for a heat wave, it is raised to orange. Or if there are 4 days of heat wave with the minimum temperature is above the 90th percentile of the historical series, and there's a forecast of extreme temperatures. And finally, if we have 3 days of extreme heat wave, so over the 95th percentile for the lower temperature. And there's a forecast of a heat wave within 24 hours, so for the next day, with a very extreme temperature above the 95th percentile in the historical series. And that is a red alert. And the alert ceases when the phenomenon is over and is expected mostly to end abruptly. And then we need to communicate the risk to the health. And here I have some examples of communication in Argentina. These are some things to share in social media, alerting of high temperatures. It's important to drink water, to eat vegetables and fruit mostly, to stay in cool and well-ventilated areas, to drink water throughout the day. And the blue charts that you see at the bottom are developed by the Ministry of Health of Costa Rica, and that are recommendations for hydration. And I thought it was really interesting because they are in different languages. And this is important because communicating the risk should be accessible to the entire population. And of course, in Costa Rica, there's diversity of languages spoken, and it's important to communicate this to the entire population in an accessible manner.
Otra de las acciones que hay que contemplar.
Another action that needs to be considered for prevention is community prevention. And this is an example of cooling centers. This has been applied in Europe, also in the US. This is an example from California, and you can see that there's a status published of cooling centers. They are libraries, some Catholic centers, some community centers. For example, think of churches in your cities, in the historic part of cities. They have high ceilings, they have very thick walls. And if you think of when you go inside during the summer, it's cooler inside. So that could be a cooling center. That could be a place to receive the population that may be at risk during a heat wave. And this communication of California presents all of the cooling centers that also have hydration stations, where they are, at what time they are in operation. And this could be easily done by working in coordination with different authorities at the local level. And there's this is an example of people resting at a club because extreme temperatures at night affect sleep. And this can also increase the risk for health. Another thing for prevention is at workplaces. It's very important to measure the heat load. We see this index that is used, the WGT, that is the bulb temperature, that integrates, combines heat and humidity. And so it shows us the heat burden that the workers are exposed to. This is done in Nicaragua. And you can see that after 8 a.m., this temperature index is over that threshold of 28 degrees. That is not, it's an integrated index. And there's also, above this is considered to be hard work. So they should rest, they should have 15 minutes of rest for every hour of work. And this is something that they have, this has been translated into some interventions of measures for prevention in Central America, with an initiative that is called the Island Network. We're mostly working with communities working during sugarcane harvesting season. They incorporated some shade and some hydration spots. I don't know if you can see the recommendation very well, but for cane cutters, from seed cutters, and from field workers, there are, for example, for 7 a.m., they need to rest 10 minutes for every hour and 5 minutes for field workers. But at 10 a.m., the rest should be 20 minutes for every hour for cane cutters and 10 minutes for field workers. And cane cutters, who are the ones that have the highest physical exertion, have a working day of only 6 hours, while seed cutters and field workers can work up to 8 hours. But you see, they start their day at 6 a.m. and they finish at 2 p.m. And they also need to take rests between 10 to 20 minutes. You see, at noon, seed cutters and field workers need to rest 30 minutes and work 30 minutes. That is the only way that heat stress doesn't cause an impact on health. That mostly translates to chronic kidney disease.
Recordarte que te quedan pocos minutos.
Francisco, I would like to remind you that you have a few minutes left. Also regarding prevention and in other massive events, for instance, this is a rock festival held in Argentina every summer. And they suggested that participants take with them some water bottles because they would have hydration stations so that they would be able to get some water during the event in order to not to run any risks regarding their health. Finally, regarding hospital readiness in order to face heat waves, we need to monitor high-risk patients in order to identify symptoms associated with health. We also need to adapt pharmaceutical treatments. We need to postpone non-urgent surgeries in order to be better prepared to deal with urgent patients. We need to ensure better availability, especially in emergency services and urgency services. Also increase healthcare staffing and activate procedures to ensure adequate health and social care for hospital discharge of high-risk patients. If we send patients home, they might suffer from the heat even more seriously. So maybe this discharge can be postponed in order to prevent further risk. And we need to ensure that high-risk patients are housed in air-conditioned wards. These are the ideal recommendations. And then we need to check in each of our hospitals how we can implement these recommendations. Also increase patients' fluid intake not only the ones that have seen their health affected. Also, we should modify diets accordingly and increase fruit and vegetable consumption. And we should adapt bedding, patients' bedding and personal clothing. Finally, there is health surveillance. This is an example of the surveillance of a plan that we're implementing in Argentina regarding climate heat-related health events. We have prepared an epidemiological form in some selected hospitals, where this first part includes the typical information about the center and also regarding more general terms. And also we have a reference to different symptoms and several conditions that have to do with heat, such as different types of exhaustion, lower volume, edema, and other internal problems. And there are other health risk factors such as diabetes and other endocrine problems, organic mental issues, cardiovascular disease, also respiratory system problems, obesity, and other serious and chronic diseases. Regarding how we should characterize epidemiology regarding risk factors, we aim to know if the exposure was work-related, leisure-related, if the person was exposed to a source of heat, or if there was intense physical activity, or maybe the person is taking some drugs that is affecting the temperature regulation, or if the person has been using drugs. If the exposure was work-related, we need to find out what the person does. Finally, here we know if the person was exposed to extreme heat. This is something that we will be using in both events. So that's all I have to say. Hopefully this has been useful. And of course, I am here ready to answer your questions. Thank you so much, Francisco. Thank you for your presentation. There are many questions and hopefully we'll be able to answer some of them. Also, Francisco, feel free to answer questions in our Q&A section if you want to write an answer as we select the questions. Thank you. Now we have Tania Vargas. She specializes in climatological research at the Subdepartment of Climate Forecasting in Peru. She has a bachelor's degree in meteorology and meteorological engineering awarded by the Universidad Agraria La Molina. She has a master's degree awarded by the Appalachian State University, North Carolina, USA. She has also worked at NOAA's International Desk Meteorology Desk. She has worked at Tsunami in Peru for 9 years, and she works mainly as a forecaster. She has been part of the climate and health team, and she is Tsunami's representative in the National Commission in charge of studying El Niño phenomenon. She will be presenting a case study. Thank you so much, Tania. You have the floor.
Está silenciada, Tania.
Disculpe, estaba con el micro apagado. Bueno.
Sorry, my mic was off. Thank you so much, Irene, and thank you everyone for organizing this event. Thank you for inviting us, Tsunami Peru, to participate in this event. Let me just share my screen so that you can see the presentation.
Okay, yes, está en modo presentación.
Perfecto, gracias.
Is that okay? Yes, thank you. Okay, this is a study conducted 2 years ago about defining heat waves. We aimed to identify the best definition because, as Francisco has explained, several definitions are used to define heat waves. What we needed was to identify one of the indices that would reflect its influence on human health. To do this, we consider two main cities in Peru, Piura and Lima. Both of them are the most highly populated cities along the coast of Peru, and they have a high population. This study included several experts, and it was led by Cristina, a colleague. She no longer works in our institution, but she was the one that led the study. Also, Laura Carlos Sanchez. Now, let us see why. Although Peru is a tropical country, and this is a topic that we must address. Do we need to monitor heat waves in the tropical areas? And the answer is yes. And in Peru in particular, this year with the coastal El Nino, we have seen very high temperatures, not just along the north coast, in Piura, where we have these increased temperatures associated with coastal El Nino. This also affects other parts of the coast. And this has affected the health of people, but also people's health, but also it has affected other sectors such as fisheries, agriculture, even forest fires. Although this doesn't necessarily take place along the coast, but on the range and in the jungle. What are the consequences of these heat waves on human health? As Francisco has said, there are indirect and direct impacts. If we talk about El Nino in particular, in Peru, we have quite a different effect or differentiated effect. Have a look at this map, for instance. In green, you can see the areas affected with extreme precipitation levels in our southern summer, which is January, February, March. In yellow, you can see the areas where there are insufficient precipitation levels. These will have excessive precipitation will have several impacts, such as increased vectors and other problems. And also, some diseases will spread more easily, such as dengue fever. In March and April, we had peaks that were similar to the trends in 2017. Regarding the negative effects or the lack of rainfall, we see an increase in respiratory diseases caused by heat stress. Also, vector-borne diseases spread more easily, dengue, for instance. Regarding El Nino, we do have precipitations, but also, as I said at the beginning, we have an increase in extreme temperatures. Therefore, the aim of the study was to determine which indices we must use in order to monitor and forecast heat waves. These were two specific cases. Piura, sorry I didn't tell you, Piura is in the north of Peru, and Lima can be located towards the center of the coast near in the capital city. So how are heat waves defined? These are the definitions we tend to use. These are unusual periods of hot, wet, or dry weather with a gradual onset and termination of 2 to 3 consecutive days, where a certain threshold is exceeded. Several thresholds or statistics are used in order to determine that we are in a heat wave. We will see this later on. These are the areas studied. We have in the north, Piura, which is usually a dry area throughout the year, except for summer where we have rains. It's also an arid area because it's included in the Pacific area of the desert. There you see in red the desertic areas. Lima is also along the desert line. As you can see, it's a temperate area that tends to be wet throughout the year. If you know, it is not humid throughout the year. In Lima, it doesn't really rain a lot throughout the year. And it's different from Piura. We have, for instance, more clouds in the winter, and Piura tends to be sunnier. Data used in the study. Here we can have both, we use two stations. The study was conducted in the hot period, part of the summer and part of autumn as well, between December and April. And we use the following data: maximum temperature, dry and wet bulb temperature, wind speed, and regarding health, we worked with the Information Technology Management, Data Management Office with information about daily mortality between 2003 and 2017, except for 2015. Regarding methodology, this was quite a process. We started systematizing heat wave information. After this calculation of thermal indices to we talked about these thresholds or percentiles to decide the threshold at which we will consider that we are experiencing a heat wave. Then we also make an association with human health, and then we analyze the information. These charts show us the snapshots taken in order to check extreme temperatures, automatic conventional stations, etc. And at the end, we have some of the results. We conducted a risk factor analysis in order to check if this association appeared between the presence of heat wave and journal mortality. Criteria. Here we have several indices used, such as maximum temperature, air temperature at 1 p.m., heat index at 1 p.m., wet bulb globe temperature, and apparent temperature. And here you can see the times. And we'll also use the daily percentiles, in this case 90 and 95. Regarding event duration, we worked with 1 day, 2 days, and 3 days. In total, we had 30 possible combinations in order to define the heat wave. It's more information about the indices. As Francisco has said, for instance, he considers that the wet bulb general temperature, also apparent temperature, which also considers the wind velocity, the wind speed and heat index as well. Regarding age groups, we worked with all the population, and we divided it into under 5, between 5 and 18, between 19 and 65, and over 65. In these combinations and groups, we conducted tests in order to determine to see which results we obtained. Regarding thermal indices, these charts maybe are not so clear to see, but we have maximum temperature, heat index, apparent temperature, etc. Here we consider also 90 percentile, and there is a difference. The higher the threshold, the lower the frequency of events. And that was the case with 2 days, and with 3 days, there was a more marked reduction of each event or heat wave. Another result we had, the systematization. This is an example for that shows a San Miguel station in Piura. Here we can see how many events we had for each month. In this case, and also depending on the thresholds, how long they lasted on average. And we found some similarities by implementing each threshold and by restricting our work to the 95 percentile. But usually the variations we found were similar. When we calculated the relative risk of mortality due to heat wave in Piura, we did find some differences. And also regarding some of the indices, we found a significant difference by using 95 percentile and considering 2 days of heat waves and implemented the maximum temperature variable. For the Sullana station, we also had this variation with a maximum temperature, but in this case for 3 days and not 2 days. When we have a look at this summary of the previous chart, this is East Lima with a risk factor higher than 1. The major indices are the ones that showed this connection between increased heat waves and increased mortality with the maximum temperature, as I showed you on the previous slide, by using 95th percentile, and for Piura as well for 2 days, and Sullana 3 days. Something similar was implemented for Metropolitan Lima. In this case, we had three significant indices. Number one, the heat index, maximum temperature of air, and wet bulb globe temperature. The three of them were significant. What is the effect of this heat wave? It will not necessarily be felt or be detected at the beginning. So we prepared these charts in order to determine how many days later we could see this effect on mortality. We studied these two cases and we only found that they had a short-lived effect from the beginning until the end during the heat wave, which lasted 1 to 2 days. And remember that 2 days was almost the maximum figure for Piura, and in Lima we found between 1.5. Finally, we systematized the heat events with the indices we had defined, and we did this for the heat period between December and April, and this is the result. Piura, with a maximum temperature in this index, and Sullana, and for Lima we had 3 indices. Conclusions. Sorry, I forgot something at the beginning. We are considering general mortality. We're not distinguishing because when we went over the data, we hadn't systematized the data, the health data we had analyzed. So there was no connection between mortality, heat, etc. So, you know, checking which diseases are associated within the deaths in the periods, in the heat wave periods, had to do with cardiac disease mainly, cardiac disease and renal disease. Coming back to the conclusions, Piura, we found that the definition of heat wave in Piura would be of 2 consecutive days in which the maximum air temperature exceeds the daily 95th percentile threshold, in particular for health. That was in Piura. Sullana, same temperature, maximum temperature index, 3 consecutive days in which the maximum air temperature exceeds the daily 95th percentile threshold. For Metropolitan Lima, we also found a 95th percentile for East Lima districts, the ones that are furthest away from the sea. Regarding relative risk or increased mortality, remember I showed you 2 values, only 2 spots. They were around 1.2. So in this case, for Piura and Metropolitan Lima, the heat wave results are very close and they contributed to increased mortality risk by 20% during the events. Duration, up to 2 days after the onset of the event, Piura, and up to 1 day after the onset of the event, in this case for Metropolitan Lima. This applied to East Lima. By using the chosen definitions in the final systematization for the warm period, we found that the events, we could have between 1 and 2 heat wave events for Piura, and in Lima, it would be between 1 and 3 events that would last between 1 and 4 days. But what has happened, and this is something that has been happening in 2023. In Peru, we used to study El Nino, we use the coastal Nino definition, which is the increase in temperatures in what we call the 1+2 El Niño monitoring region in the north of Peru, bordering Ecuador. That is the Western Pacific. When the temperatures increase in this area, they directly affect the air temperature. And this heat, or this event begins in February and has lasted until today. And it is affecting the increase in temperatures. We've had a hot summer, a hotter autumn, a warmer winter as well. Maybe now in spring, we have noticed a small decrease of temperatures. So this is one of the monitoring sessions conducted at Tsunami. And this monitors the center, north, and south of the coast. Have a look at this, please. We have detected some days where the 90th to 95th percentile have been exceeded, and several records have been broken as well. Since the beginning of the historical series, we have now new values. This coastal Niño has caused some increased temperatures or global increased temperatures along the coast. So some days have exceeded these thresholds regarding temperature, but this has decreased in the last few days. As I have said, we have we have detected many record values. On this chart, we can see how many degrees above the usual temperatures we have seen. This is a case for maximum temperatures. For instance, in May, we should already have a trend, a temperature decrease trend. But for instance, in Lima, we had 31.5 degrees as a maximum temperature, and the normal figure would be 24.6. So we have daily records, monthly records as well, because in July and August of 2023, we had the warmest months, not just along the coast, but also nationwide, and considering the records that we've had since 1994. That was maximum temperatures. And also for minimum temperatures, as you can see, we have recorded new records of extreme temperatures in most of the coast. Well, thank you so much for the opportunity to make this presentation. And of course, Francisco, I'm ready to answer the questions that people might have. Thank you. Thank you, Tania. We have so many questions. Some have already been answered in the chat, in the Q&A section. Thank you so much, Francisco, for your help. Let's have one question for Francisco. Do you know how we can tell about the cause of death because of heat? Maybe this could have done during the COVID pandemic to distinguish between COVID-related deaths and heat-related deaths. Sorry, that's a great question. It's interesting because many times it's difficult to determine which factor actually leads to someone's death. Someone asked this in the Q&A session, and they said that just saying that diarrhea cases would increase because of temperatures is a bit simplistic, because of course we know there are many factors that affect the appearance of the onset of a disease. Our models aim to control these factors by controlling different causes, we can determine if one of these factors increase the risk. But models always simplify reality. Regarding deaths or heat-related deaths, in every country in our region, deaths are determined according to the International Disease Code. There is a code which is X30. It is related to mortality on account of extreme heat. When we wanted to study that summer in particular, 2013, 2014, and we looked up the code, there were many deaths that had been coded according to this code, something like 8 in one summer. So what did we do? We analyzed general or global mortality. And then I have a question for Tania, but I want to stay focused. When I talk about global mortality, we only analyze natural causes. We excluded external causes. Otherwise, we would be including traffic, car accidents, and other factors that might confuse us. Among the natural causes, we analyzed increased risk by comparing two periods. A period with a heat wave and another reference period without the wave, and we studied the increase and if it was significant. We did this for natural causes and for other by age group as well, and some causes of death such as cardiovascular, respiratory, renal, diabetes related. We had enough epidemiological evidence and epidemiological feasibility explaining the connection between heat and dying because of caused by one of these conditions. Thank you, Francisco. Another methodological question addressed to Tania. How do you measure temperature data? Because someone's asking if measurements are affected if we're talking about an indoor and outdoor place. Yes, regarding data measurement, the WMO says that the seasons or the temperatures are recorded in a not a fully closed station. They have some, areas where the air can enter. So an observer goes to the station, they take the measurements, and they record the measurements. In the case of automatic stations, there is a sensor that automatically records the temperature and reports the highest, and they report the highest peak. Thank you so much. There's a question about mental health because people are more interested nowadays in mental health in general. Someone asks, in Canada, some people were disproportionately impacted if they had some sort of psychiatric condition. Are there trends in this regard? That's a very interesting question. The latest IPCC report talks about the need to study mental health and climate change. As we analyzed the data classified into regions in last year's report, we saw that we had insufficient information for the Americas regarding the connection between mental health and climate change. Why? Because the topic hasn't been thoroughly studied, not because the risk doesn't exist. I think that the main challenge in this case is to study how the information is produced. Usually our health systems, health information systems focus on conditions or infectious diseases, and they focus on mortality as well. Usually mental health problems do not necessarily lead to deaths, or this is not seen. So our current statistics are not collecting this type of data. And this is a case for other events as well. Therefore, we need to implement new strategies in order to collect this information. And these are not quantitative methods. We might have to resort to social science strategies in order to explore the topic, or maybe address, hospital discharge figures, consultations in health centers to see if see what happens with mental health centers or mental health hospitals to see if there is a change in the mental health appointments. But yes, this is a huge field to study that hasn't been thoroughly studied, as have other topics such as emergency appointments, etc., and their connection with extreme heat events. Thank you, Francisco. Tania, you showed us some really complex charts, which are easy for you meteorology to understand, but not so much for us. How can we deal with these risk factors in Peru so that health experts can understand them? Nowadays, we only have this study conducted in Piura and Lima, but we are now systematizing events and heat waves, not just along the coast, but also including the Andes and the Amazonia. But for now, we only have these risk factors calculated for Piura and Lima. In this case, is there a difference between the coast and the Andes? Yes. Basically, this might have to do with heat waves. On the coast, we have an arid area where temperature increases, usually humid heat waves. However, in the hills, humidity content is low, and when we have high temperatures, they're mainly associated with dry conditions. And in this sense, the impact is different as well, because they might be connected with forest fires. And this is another triggering factor, because we have increased temperatures and also there is contamination, organic material that is burned, and wind might spread these conditions. Therefore, the impact is higher. There are more indirect impacts that are not so closely associated with heat waves. Something similar happens in the jungle because it's also a very humid area. And we might have some effects similar to the coastal area. On the hills area, yes, the conditions are quite different. Thank you. Francisco, you said that you use a southern cone perspective because of our clear seasons. But maybe there is a change in the climate trends. We might have a new category, as in new seasons. Is that the case? Well, maybe that's a bit too conclusive, because I am no expert in atmospheric sciences. Tania might answer this. But as I understand, in this changing climate scenario, I think that seasons might be a bit blurred. And this is at least what we have seen regarding pathogen distribution. Maybe in the past, pathogen distribution was clearly seasonal. For instance, summer diarrheas, which is something that happens often in Argentina. Also, I don't know, pneumonia in the winter. But now this seasonality is blurred. Yes, but I'm not sure if that is the same, that affects the climate as well. Maybe I can say something about that. Seasons. Seasons are defined by our planet moving around the sun. So some dates are fixed, but regarding pattern changes or changes in the system or circulation, sometimes we see that the summers are longer. Yes, there's a change. I think that this year, at least in Peru and Ecuador as well, the changes have been clear, because we have seen very high temperatures, and people would say, okay, summer is now longer, because we've had the impact of El Nino in this case. Other years, 82, 83, 97, 98, we also had these El Nino events. And we also saw a clear change along the coastal area regarding temperatures. There was no winter because the temperatures were high throughout the year. And this is something that we already see. Thank you for your contributions. We might be talking about new epidemiological seasons and not necessarily climate-related seasons. One more question. Francisco, do you think that this idea of having fresh centers can help us face these heat events and also address some social health determinants? Yes, these are experiences in central countries. We will need to see how we can adapt them to our reality. You know, for instance, shopping centers tend to have very good conditions, temperature conditions. Also churches, which tend to be quite cool in the summer. Also, we need to downscale this project. For instance, elderly people that live alone, and the risk increases because if they need something, they might have no one to ask for help. So we need to think about primary care centers at a hospital, for instance. I don't know, cultural centers, libraries, a center for retirees where they can, I don't know, have some fun and stay cool. That would be interesting. And I think this has to do with another question. It's like these are many there are many solutions regarding our client scenario. Shouldn't we adapt our cities? Yes. I prepared this presentation by considering this new ENSO phenomenon, and hopefully for March, April of 2024, we will be able to say goodbye to this event. So regarding El Nino, we need a quick response. And regarding climate change, thinking about these cool centers is just the tip of the iceberg. We need to think about how questions can create less heat and decrease this urban heat island phenomenon with by using less public transport, by getting people to move less and to come up with more human scale solutions and not huge human scale cities and not huge cities. But I'm being more humble in my recommendations. My recommendations have to do with the health sector, actually. Thank you so much, Francisco. So this is the end of today's session. We'd like to thank our panelists. I am so happy to have heard you, to have listened to you today. And I'm sure the other participants are very happy as well. There are so many questions that we cannot fully answer during the session. I would like to remind you that next session on Tuesday is about quality, water quality and security. We'd like to thank our interpreters as well who have helped us today. Thank you to all the organizing partners of our course and of today's session. And thank you to the participants.